Cardiac Arrest Decision Support Tool Education. For quick and easy access into the CodeBlue pathway, select the CodeBlue Quick Launch button located on both the initial login screen or the pin screen. Upon entry into CodeBlue, the first screen prompts you to assess the patient's breathing. Selecting gasping or not breathing here will take you through a basic BLS pathway, requesting help and assessing pulse. However, if you know the patient does not have a palpable pulse or CPR is already in progress, select the CPR in progress button to provide a shortcut to the timer screen. This shortcut button will be available in the first 3 screens. We will select CPR in progress now. A 2-minute compression timer is initiated. If not already providing CPR, begin chest compressions immediately. Select your available device. As soon as the device is attached, select the Device Attached and Analyzing button. Here we have selected AED. Once you enter the AED screen, the CPR timer goes away to allow the AED to provide timing and rhythm treatment prompts. Press the Shock Delivered plus sign button when the AED provides a shock to the patient. This will provide a timestamped entry for each shock. Once a defibrillator arrives and is attached and ready to analyze, tap the Defib Arrive button to assess the patient's heart rhythm. Select your patient's rhythm and follow that algorithm's prompts. For VFib or VTAC, the defibrillation sequence will be presented. Press each circle once that task begins. After the second shock is delivered, epinephrine will be open and actionable. Press the button immediately once the medication has been administered to the patient. Note the amiodarone button is now present but locked. If early amio administration is requested by a provider, press the amio button once to unlock it. Once the compression timer again counts down to 0, you will be prompted to stop compressions and check a rhythm and pulse. Note the arrow in the top left corner. If you choose the incorrect rhythm, simply press the back arrow. After the third shock is delivered, amiodarone will be open and actionable. Press the button once the amio has been delivered to the patient. Utilize the CodeBlue Document button to review all interventions completed during the event. Each entry is timestamped to the second for accurate reporting. Note the 4 timers running at the top of the screen, keeping you on track. Select the thought bubble icon to add comments at any time. Here we will add family to bedside. Again, no matter where you are in the tool, once the compression timer counts down to 0, you will be notified. PEA is the rhythm selected here. When selecting either a PEA or a systole rhythm, the Start Compressions button will be present, and the epinephrine will be the only actionable med timer. Utilize the CodeBlue Interventions button to document any other medication or interventions initiated during the event. Here, we are documenting an existing IV, then labs sent, fluids initiated, and other code meds given. An H's and T's checklist helps you to think through reversible causes. Get back to the main screen at any time by pressing the Return to Interventions and/or Return to Main Screen buttons. There are 2 ways to end a CodeBlue event. Press the End Code button in the header at any time during the code, or choose the Has Pulse button in the rhythm screen. Congratulations, you have completed the Cardiac Arrest Tool Education.